Hello, in this video, I'm going to talk about arthritis and exercise recommendations and guidelines for people with arthritis. So what is arthritis? It collectively is inflammation of the joints. So depending on the type of arthritis in the individual, it could refer to arthritis in one specific joint, or it could be many joints, it could be dozens of joints. It depends on what type of arthritis it is, what is causing it, and the individual presentation. There are over 100 types of arthritis in terms of what is causing the joint inflammation. So lots of different disease processes and mechanisms that can cause arthritis. So there are over 100 types. Different types affect different joints and cause different degrees of joint damage, restriction in range of motion, cause different functional limitations, and cause different amounts and types of pain. So even the type of pain that someone describes in their joints might be indicative of the type of arthritis that they have. So some common types to mention here of our 100 plus, a few common ones are osteoarthritis, which is by far the most common. And that is arthritis that's caused by wear and tear on the joints. So it could be that the person had an injury in that joint at some point, and then due to the way it healed and chronic wear and tear on that joint after it healing, could result in osteoarthritis. Obesity also, unfortunately, makes somebody prone to osteoarthritis, especially in the knees, because of weight bearing with the additional body weight. But osteoarthritis really could happen in any joints, just depending on the person and where they're having a lot of wear and tear on those joints. Some individuals might be more prone to it than others due to genetic factors or playing a certain sport or playing at a certain level of activity for many, many years. They might be more prone to osteoarthritis than somebody who did not have that level of activity or play in that certain sport, just as an example. Rheumatoid arthritis is an autoimmune disorder, meaning that the immune system is attacking our own body. So that's what an autoimmune disorder is. In rheumatoid arthritis, it's that the immune system is targeting the synovial membranes of our joints. So in rheumatoid arthritis, the immune system might attack dozens of different joints in the body. There are some joints that are more prone to being affected by rheumatoid arthritis than others. So like, for example, these distal joints between the, I can't think of the right word, the distal and the, not the proximal, because that would be all the way proximal, intermediate. Okay, so the joint between the intermediate phalange and the distal phalange of your digits, those are less likely to be affected by rheumatoid arthritis. And then there are some joints that are very prone. So like the other joints in the hands and the wrists and the feet and ankles. The spine isn't usually very affected in rheumatoid arthritis, but the sacroiliac joints might be. The TMJs certainly are. So it presents differently in different people. So some people who have RA might really only experience it in their knees, or they might experience it only in their hands or their feet, or they might experience it in dozens of joints throughout the body. So RA is a very individual sort of experience where different patients will have different symptoms and different presentation. And some have more pain outside of flare-ups than others. So like some people, they're really only suffering during a flare-up, and others, the pain and the symptoms kind of extend beyond just the flare-ups. Gout is another type of arthritis. It happens when we have an accumulation of uric acid in the blood. So it's either that we are producing more uric acid or that we're not clearing it adequately. So it's often diet related. So like we're taking in certain types of foods that are more prone to causing us to produce too much uric acid. But it also can be because the kidneys are not doing an adequate job of clearing it fast enough. But in either case, we have an elevated amount of uric acid in the blood, and that uric acid is deposited into joints and crystallizes. And so it causes this very sharp Like think about crystals, like sharp, jagged crystals being inside of the joint. So it causes that sort of sharp, jagged pain. And it most commonly affects the big toe and sometimes the thumbs, but the big toe. And so somebody who's complaining of like sharp, jagged pain in their big toe is likely gout. Spondyloarthropathies, that is a whole family of types of arthritis. So there are a lot of different kinds of spondyloarthropathies. And so they vary in symptoms and what joints they affect and how they affect them. But what the whole family has in common is that they generally affect the sacroiliac joints, in addition to whatever joints the specific types also affect, but they all tend to affect the sacroiliac joints. And they tend to affect the attachments where the tendons or ligaments attach to bone. So outside of the joint itself, so outside of the joint capsule, well, and ligaments can be inside the joint capsule, part of the joint capsule, or outside of the joint capsule. And tendons are always outside of the joint capsule. So it's affecting those attachments which might be inside or outside of the actual joint itself. But they cause pain that is like bone pain, essentially, which is very sharp and painful at the attachments of those tendons and ligaments at different joints in the body. Okay, so if somebody has arthritis, the pain they're experiencing can be, and lots of different anatomical structures that are actually hurting. Depends on the type of arthritis, what's causing it, and the individual presentation. But sometimes it's the bone that's actually hurting. It could be the joint capsule, the muscles, ligaments, tendons, synovium, meaning like synovial membrane, the articular cartilage, and it can be the subchondral bone. Subchondral meaning under the cartilage. So if the articular cartilage has been worn away or damaged or torn, then the subchondral bone, the bone underneath where that cartilage should be, then is exposed and can become damaged by friction in the joint. So treatment for arthritis, of course, depends on the type and cause of the arthritis. Like treatment for osteoarthritis is going to be extremely different from treatment for rheumatoid arthritis, because in rheumatoid arthritis, it's an immune dysfunction. So most of the medications and things are targeting the immune system. Versus osteoarthritis, it's a musculoskeletal wear and tear type of injury. So it's going to be more aimed at muscle function, range of motion, and that sort of thing. So you still can target muscle function, range of motion, and so on with any kind of arthritis, regardless of the cause. But the whole treatment plan is going to look pretty different depending on the type and cause of arthritis. So for any type, exercise is going to be beneficial. It's not going to be harmful, and I'll talk more about that in a minute. It will be beneficial because it's never a bad thing to have stronger, more functional joints and muscles and greater range of motion. Education is important because there might be certain things that they need to do or avoid. PT and OT can be very helpful, especially depending on the type of arthritis. Some might require braces and bandages because if there's just too much pain or the joint becomes too unstable to support body weight, and especially with exercise and different types of sports and things, somebody might need to wear braces and bandages to prevent worsening the injury and to add more stability and reduce pain. They might require canes and other walking aids if they're having difficulty walking and being stable with their arthritis. Could require shoe modifications and orthotics for similar reasons, especially like in rheumatoid arthritis, or it could be osteoarthritis, but in the that's affecting the feet and ankles, that could especially help a lot. Weight reduction, no matter what kind of arthritis somebody has, if it's affecting joints in the lower extremity or the spine, then carrying less body weight is going to improve the condition. So even if it isn't the body weight that's causing it, the excess body weight will make things worse because it's more weight, that's more force that's being placed on those affected joints. If they're upper extremity joints, then we might be able to debate how much that would help. but I'm sure we could make an argument for how it would still help in upper extremity. And then avoidance of repetitive motions. That's true for everybody all the time, but especially in osteoarthritis, if the repetitive motions are contributing to the development of the osteoarthritis in the first place, then we especially want to avoid those motions because those are going to just keep making the problem worse. And then there are other options like joint irrigation and surgery. There comes a point where a joint just might be so damaged that it requires a joint replacement or some other type of surgery that helps very significantly, especially in osteoarthritis and really advanced cases where they might want to do a knee replacement or something like that. I have never had a patient regret getting a joint replacement when they get to that point where they need it and the doctor recommends it and the insurance approves it and all of that. Most patients who replace the joint and they go through with it, usually the feedback is, I can't believe I didn't do that sooner. I could have had all these years back, when people are putting it off, because it helps so significantly, so immediately. So of course you have to recover from the surgery, but then you recover and you feel so much better pretty much immediately. Okay, exercise recommendations for someone with arthritis are the same as any other healthy adult. So you want to accumulate as much activity as possible, at least 150 minutes a week of moderate intensity and at least 75 minutes a week of vigorous intensity. So either or some blend or combination somewhere in the middle. And you want to burn at least 1,000 calories a week from physical activity and cardio. And then resistance training 2 or 3 days a week, 8 to 12 reps, 1 to 3 sets, standard recommendations. So I do have some extra precautions and guidelines for someone with arthritis. So although the type and quantity of exercise might be the same, you do want to pay attention to some specific things here. It is common in people with arthritis that they lose muscle strength, muscle mass, and aerobic capacity, largely because they're in pain. And so they might be avoiding physical activity that they would have engaged in otherwise. And there also might be some amount of fear. So depending on how much pain they're in, how prone they are to flare-ups or what kind of arthritis they have, there might be some amount of fear of physical activity because they think it will make it worse. And they're already so miserable or having so much pain or whatever it is that they're going through, that they might be afraid of making it worse. And so then you get somebody who has a pretty significant decline in muscle and aerobic function because of it. Exercise won't exacerbate joint damage, pain, or inflammation, as long as you follow a few guidelines that I'm going to share with you here. But in general, exercise is okay. Exercise is important and will help improve their condition, not make it worse. So for inflammatory types of arthritis, there's a few things that you want to make sure that you're paying attention to. And rheumatoid arthritis is a type of inflammatory arthritis, but it's not the only one. So that's really a whole category of arthritis, arthritises that are inflammatory in nature. So they tend to be more systemic, so it'll affect lots of different joints, and they include flare-ups. So they might be better or worse at different times. And people are very individual in terms of what might cause a flare-up. So somebody might have a flare-up because they ate too much sugar, or they didn't get enough sleep, or it could be related to stress, or, fill in the blank for each individual. People kind of feel it out and figure out over time what their specific triggers are that cause flare-ups in them individually. So during a flare-up, they could still exercise, but you want to reduce the intensity and duration, and it should be proportionate to how severe the flare-up is and what they're experiencing. So if it's really bad and they're really in pain and they're having a very hard time, reduce the intensity and duration significantly and make it a session that is going to help them feel better. So improve range of motion, work on reestablishing range of motion and blood flow. So work on those things that are going to feel good. that is not a time to try and push them to a new level or get them to work through the pain. You want them to keep coming back. So do something that feels good and will encourage them to exercise and do flexibility training and things like that, even if they're having a flare up. Outside of a flare up, you want to do daily range of motion and flexibility training as tolerated, depending on how their joints are feeling and so on, and how much damage there is. And so obviously they could do that on their own, but you want to encourage them to do that, and you can give them, homework to do and that sort of thing. They should avoid high impact activities, especially if they're taking oral steroids, because they will be more prone to harm if they are taking oral steroids and engaging in high impact activities. So avoid those. Stick with like cycling and swimming and things that are low impact. For rheumatoid specifically, within our category of inflammatory arthritis, rheumatoid, so people think of it strictly as arthritis, but it actually affects a lot more than just the joints. So rheumatoid affects the eyes and the lungs and blood vessels. So it affects a lot of different things. And so the rheumatoid arthritis community actually for a long time has been pushing to call it something else, because arthritis is one symptom given a very severe part of the condition, but that is one piece of the puzzle, and there's a lot more going on. So someone with rheumatoid has increased risk of cardiovascular disease, so that is something to keep in mind and to make sure that you are programming for. So you want to make sure that you are working to prevent cardiovascular disease, especially in a rheumatoid patient. Rheumatoid arthritis causes morning stiffness. So you wake up in the morning, and all of that person would wake up and all of their joints would feel stiff, maybe painful depending on the person and if they're having a flare up, but there's this stiffness, like your joints are locked in concrete, and it makes it hard to establish range of motion and to get moving in the morning. And that morning stiffness can vary in the amount of time that it lasts. So somebody might have morning stiffness every morning for 20 minutes. And then kind of once they're up and about and having their coffee or whatever they do, it might be better. And others, it can last for 2 hours in the morning. But morning stiffness does improve with stretching. Hot shower feels really good. Doing some light exercise to help warm up the tissues. So warming up the body and improving blood flow helps to reduce that morning stiffness so that you can narrow down the length of time that is happening. So you can give them some tips and things to help them establish a morning routine so that they can reduce the amount of time that they're experiencing that morning stiffness. With someone with rheumatoid and with any kind of arthritis that affects the spine, you want to avoid extreme neck movement, so extreme range of motion in any direction, and you want to avoid putting any kind of pressure on the neck. So that especially like on the posterior neck, like you don't want to do a back squat where you've got a bar kind of resting on the neck, like maybe move it down, like do a lower back squat where it's positioned across the top of the shoulder blades, but you just want to be really careful that you're being especially careful with form and positioning, and that you're avoiding exercises that are going to put any kind of pressure on the neck at all. You want to avoid overstretching or applying force to misaligned joints. So in rheumatoid, there is a tendency for joints to be out of alignment and for the bones to not quite be in the right place or to be lined up correctly. And you especially want to avoid putting any kind of force on those joints in those positions, because then you're going to be more likely to not only increase the inflammation in those joints, but also to cause damage to some of the other structures in the joints. In rheumatoid arthritis, it very especially affects the wrist. Okay, so you can expect in an RA patient that they're going to have some wrist problems and some wrist pain. So any exercise where they're on all fours, where their wrist would be in hyperextension, be careful with that. Maybe avoid those completely, or use a modification where they don't have to be in that hyperextended position, because that will exacerbate their symptoms and will not last long, that kind of exercise. Use low impact aerobics to increase walking endurance and ability to participate in daily activities. And it will also help to decrease their pain, fatigue, and depression. So in RA, there's pain that can be body-wide. It can affect dozens of joints throughout the body. And that pain can also lead to some depressions. There's a higher incidence of depression in RA patients because they're in so much pain, and it interferes with participation in daily activities, which adds to depression because you feel left out, you feel like you can't do things you want to do. And then fatigue is another significant symptom in RA. So just this feeling, like it kind of goes with the morning stiffness too, like this feeling of being locked in concrete. It's hard to move and your body is so heavy. And so it's similar to the morning stiffness, but fatigue is very significant in RA. So if somebody with RA is telling you how exhausted they feel and like they feel like they can barely, like they're trudging through their day and they can barely move their body, that's the fatigue. Okay, ankylosing spondylitis. That is one type in the whole family of spondyloarthropathies. And so ankylosing spondylitis specifically affects the spine and the chest wall. So in somebody with this condition, you want to use flexibility exercises for their neck, back, shoulders, and hips. So in ankylosing spondylitis, the spine will tend to stiffen and lose range of motion, and they start to get that kind of hunched over posture. So you want to work hard with this person to maintain range of motion and flexibility in the spine, and then of course in the connections of the extremities to the spine. So you want to really focus on shoulder mobility, hip mobility, and spinal mobility. You can also do breathing exercises with them because the condition also affects the chest. So you want to work on breathing exercises to maintain mobility and work on chest expansion. And then to try and prevent that hunching of the spine and that posture, you want to focus on strengthening all of the posterior chain muscles. So strengthen the back muscles and the hip extensors to help prevent that hunching over and keep them in an erect posture. You want to keep the neck aligned with the trunk to minimize pain during activity. So aligned with the trunk as opposed to an extreme forward head carriage, or this person might have a hard time doing like crunches or sit-ups or that sort of thing because their head is not stacked on top of their trunk, and their muscles and their mobility might be less capable of coping with a position like in crunches where you're having to lift the head. And then swimming is an excellent activity for somebody who's having a quote unquote stiff day. And swimming really is good for any kind of arthritis. You know, RA, it's really excellent for that too. It takes that weight bearing off of the body, and it offers some relief and resistance, and you can get some exercise that way without having to weight bear. Okay, some osteoarthritis guidelines. So osteoarthritis is not systemic, it's wear and tear. It's caused by wear and tear. So it's specific to the joints that are being used excessively or have been injured. So for those joints that have OA, you want to move them through their full range of motion every day and work on maintaining the mobility. And it will also help to slow the deterioration of the cartilage in that joint. So somebody with OA, like especially in the knees or hips, or, you know, there's all kind of OA in any joint really. People tend to kind of coddle it. They don't want to move it. They want to maintain its stability and not weight bear. Like for somebody who's not actively trying to engage in a program or something, and they haven't been taught or educated how to make it better. Like our human tendency, our nature is to protect it and stop moving it because moving it hurts. And so we want to work against that, work outside of that natural tendency and make sure that we move it through full range of motion, because the idea of use it or lose it is absolutely true. For all of us, really, if we're not using our full range of motion, then our range of motion becomes more and more narrow over time. And that is especially true in osteoarthritis. So they need to move through full range of motion every day in those joints that are affected. Strengthening muscles will improve the function, pain, and quality of life, even in very severe osteoarthritis. So strength training is very important. Aerobic exercise helps prevent depression, which again, when people have life-limiting arthritis, so like they're not able to participate in the activities they used to, and maybe they're laid up in bed more often than they used to be, and their life is different because of arthritis, that makes us more prone to depression. So aerobic exercise for anybody, and especially in the case of OA, helps to prevent depression. Stick with low impact activities, especially if the joints that are affected are in the lower extremities or spine. So no high impact stuff. They might benefit from braces and supports for the affected joints, and higher activity levels promote better function. So in OA, more activity is better. So that's not necessarily true in all forms of arthritis. Like rheumatoid arthritis, that's not necessarily the case. You want to find balance because too much is a problem and too little is a problem. But in OA, according to research, it appears that more activity leads to better function. So more activity is better. All right. Thank you so much for watching, and I'll see you in the next video.